All right, everyone. Hi. Thank you so much for joining us. Thank you all for joining us this morning, afternoon, or evening, depending on where you are. So for those of you that who haven't met me, I'm Quentin. I've joined GFAN now a few months ago, so I think it's probably the last time I'm introducing myself. So I'm the new Communication and Advocacy Officer. So this call is being recorded, and we'll post the recording on our website as usual. All our speakers are here, so I think I'll just hand the mic over to Katie for an introduction of our speakers and of the topic. Over to you, Katie.
Thanks, Conte, and thanks everybody for joining. This is quite a different conversation for some of you who are more used to joining our regular GFAN calls, but digital transformation and new digital technologies are concepts we hear a lot about, but as GFAN members and colleagues, we haven't really had the opportunity to dive into these discussions. We've tried a few times, and global pandemics have gotten into the way and prevented people's travel to certain events and those kinds of things, but we've been wanting to bring this conversation back to you all for quite some time, and just excited to have this conversation. Conte and I thought that this is a bit of a departure from our regular calls, but it's important to start off our discussions by getting an update on some of the work that's being done and discuss together what role we see for the Global Fund in broader work to ensure that digital health technologies, transformations, and undertakings are equitable and rights-based. We're amongst friends here, so let's be honest. Digital ID systems that collect personal and biometric data make us both hopeful and a little bit nervous. Hopeful because wouldn't it be nice if technologies could help us transform the response to the 3 diseases and to ensure more equitable health access. But we're also nervous because these transformations are often done in opaque ways with a sector that we are not as accustomed to working with or have as many avenues of entry into. And we sometimes see digital transformations as the answer to those common phrases that we hear about more efficiency and more effectiveness, but we don't always see how that works out. And it's not that we're unwilling to see change, but because a lot of us have seen or heard about privacy breaches and other examples where key and vulnerable populations who are at the core and the heart of our work as communities and civil society actors within the Global Fund sphere have had negative, discriminatory, and sometimes downright dangerous experiences with digital health technologies. And countries, governments, regional banks, bilateral, multilateral institutions are all at very different stages in their considerations of how to use digital technologies in health. I was reading just a week or two ago about a new digital ID bill in Jamaica, where there's concerns from, in particular, the trans community about the collection of biometric and personal data on a card that would be used in their daily lives for a number of different things, including for healthcare. And one of the challenges is that the bill in its most recent version requires a person's sex assigned at birth to be indicated clearly on the back of the card. And so for a number of trans advocates and activists, they're concerned about the chance of possible discrimination as a result of that, as well as it's a voluntary system. And so while people can opt out of using it, there could be some sort of functional exclusions as a result of those kinds of things being included, for example, on the card or within the data that's within the card. And, in my reading, again, very recently, as I think it's a concept that a lot of us are thinking about around colonialism and getting past some of those bad habits in global health. And I've seen the term data colonialism popping up more recently. The idea that the resource that's being removed from the place of creation changed and returned with kind of only marginally more benefit than when it started to those who are at source. And that's could be true of data as well. And that's people's personal health data in the case of when we talk about health technologies. That said, I couldn't agree more when I've heard Peter Sands, the head of the Global Fund, speak in the last few months about the need for a data revolution in the work that we do. It's crazy to me that we have real-time data for COVID in place all around the world, and yet we see 6 to 8 month lags in data for the other diseases that we've been working on for decades. And so, we can we can do, we can do better, we can do more. And the hope of digital transformation is that we can improve our work as a result of having more, better, and faster access to data. And after all, like, none of us is particularly a stranger to evidence-based decision making or calling for it in what we do. So how we do it and not create inequities and where it drives better outcomes for people is the core and key questions that I think that we still have as advocates, and how we want to see institutions like the Global Fund, governments, regional banks, et cetera, transforming their use of digital technologies are, the big questions. And I'm lucky today that we're joined by John Fairhurst from the Global Fund, Mike Podmore from STOPAIDS, and Njide Ndili from PharmAccess, to walk us a little bit through some of their conceptions and perspectives as we embark on this. I don't know if we need to do introductions for everyone, but just quick ones. Mike Podmore is the Executive Director at STOPAIDS and a member of GFAN Steering Committee. As part of the Developed Country NGO delegation to the Global Fund and past board member for the same, he has been working with colleagues in civil society and communities on digital health issues for a number of years. And Njide Ndili is a new friend to us and a country director for the PharmAccess Foundation, which is an international NGO dedicated to facilitating affordable access to quality healthcare in Africa. And PharmAccess also has a digital agenda with a goal to improve health outcomes in various settings and towards UHC. John Fairhurst is the head of the private sector engagement at the Global Fund and has been with us on this journey towards GFAN conversations on digital health technologies for a few years now, and we're just really glad to have you here today with us, John. So the way we're going to go about this is we still want to reserve a lot of time for all of you to ask your questions and to have a discussion towards the end of the call, but we've set aside about 30 minutes here on the agenda to hear from these three speakers, and we have sort of quick questions for them to get them started. But just a reminder to the panelists, we'll ask a question to each of you, but you have an opportunity to answer those questions in your remarks. It's not formal. Nobody's going to be upset if you dive into a few other topics than what we ask you. So, and then we'll have an opportunity for Q&A and discussion afterwards. So, Mike, first question to you. New digital technologies have rapidly transformed all kinds of sectors and look to be doing so with health. What worries you when it comes to their role in health, HIV, TB, malaria, and policy and health policy more broadly? And what excites you? What interests you? What do you think are some of the possibilities? So, Mike, over to you.
Thanks, Katie, and hi, everybody. Really good. I'm really happy that GFAN has pulled together this discussion. It's just really critically important. So just by way of a little bit of sort of further background, so I'm director of STOPAIDS, and STOPAIDS is part of the Digital Rights and Health Advisory Group, an international coalition that includes GMP+, Kellyn and the Graduate Institute and Oslo University. And together we've been conducting research into the implications of digital health technologies on the rights of young women and marginalized groups in 5 countries, and advocating for a rights-based approach to health in the digital era. Now, we sort of came together originally in 2019 because we were fearful that the use of digital and AI interventions in health might actually threaten rather than advance human rights, especially the rights of young people, women, and the most marginalized, including particularly criminalized populations. We realized how little we knew about digital technology and how little the risks of these technologies were being talked about or addressed alongside the very relevant and right excitement about the opportunities. We saw the Global Fund making partnerships with tech giants like Google in India, and from our perspective, there just didn't seem to be enough safeguards in place or being talked about. We've also sort of worked over the last couple of years with Joop Lange Institute to develop some thought pieces for the 3 civil society and community delegations of the Global Fund, and just wanted to highlight that particularly, obviously, in the context of GFAN. But these concerns and opportunities that we were sort of like suddenly wanting to mobilize around, they've only sort of further compounded in today's context. Financial investment in digital health is rising dramatically from 8.2 billion in 2018 to 14.1 billion in 2020. Decision makers and health agencies are moving quickly to capitalize and develop digital health strategies. And of course, the COVID pandemic has led to the rapid design and scale up of digital interventions for epidemic control. And we're not entirely clear how the data is being used, whether it's cost effective, etc., etc. So with the flurry of digital apps, tools and systems that are increasingly entering our personal lives, as well as being applied to health systems within countries and global health agencies, just in response to your question, Katie, there's sort of maybe 3 concerns I wanted to highlight, and then I will also touch on a couple of exciting bits. So those 3 concerns are broadly, have we got the right policies and regulations in place? Secondly, are civil society and communities involved in digital design, implementation, evaluation and governance? And thirdly, how can we increase the low levels of digital literacy, understanding and knowledge around digital technology and, crucially, digital rights? If we can address these, I firmly believe that we can turn our concerns into real opportunities for enabling and empowering communities to utilize digital tools for their objectives. But we have to address those. So just to go into a bit more detail on those 3 concerns. Firstly, do we feel happy that decision makers in global and national health agencies are putting in place the right policies and regulations to ensure that digital technologies and AI do not harm individuals or infringe their human rights? Are they designed and used in ways that put people and their needs at the center? And how can duty bearers enable and incentivize new or existing digital technologies to address the particular needs of key and vulnerable populations? So there's a couple of bits here that are really important that we start to focus on. Access to these technologies, data, privacy, and well, I'll touch on those 3 and then come into the second area. So firstly, on access, it's all very well promoting the benefits of digital technology, but it will only drive further inequality if many of those who are already marginalized don't even have access to it. So this is definitely a headline issue in the 3 countries that we're starting to do research in. And the digital divide, we know, is particularly shocking for women and girls. And there's, as well as a lack of diversity and community involvement in the design. On data, many risks are linked to the underlying data itself. All digital technologies and AI rely on the data that we put into them to work. Data seems neutral, but of course, actually, it's inherently political. We know this as Global Fund activists because we know that when key populations are criminalized, the data gathered about them might be completely lacking or not there at all. And if we do not have accurate data about at-risk populations, if there are missing data sets, then we cannot see the full picture. And key populations are therefore unlikely to get the right funding or support they need to access healthcare. This is an issue that we've been facing for years, and now it's being magnified by digital systems and AI. If we put in bad data, we get bad results. And so we risk replicating the very inequalities that we're seeking to fight. On privacy, where data is collected and managed, it also poses a risk to privacy. For marginalized and criminalized communities, privacy violations pose significant risks to their access to healthcare, freedom from stigma and discrimination, and even their life. Decision makers and global health agencies need policies in place that will recognize and safeguard human rights, especially the rights of women, youth, and marginalized communities. And this involves working with communities to best understand how best to gather their data and how it should be managed. Really good example of that not being done well is in the use of biometrics and gathering key population biometrics in Kenya, not done in coordination with the key population groups there. So the second area I just wanted to highlight really is around as governments and global health agencies grapple how to govern digital health, we need to empower communities and civil society in digital health. So communities need to have the funding and support to design, lead, and assess digital initiatives. And it's critical that they're also meaningfully involved in the governance of digital technologies and AI. What we've seen is that the design and development of new digital technology and AI has been mostly led by the private sector and mostly by white men in northern countries. And they are driven almost exclusively by a profit incentive. And so with private sector leading the development of new technologies and AI, the involvement of citizens in digital design has been limited in diversity, with the most marginalized left behind. And so we see those, not, the vulnerabilities and barriers they face sort of are not being put at the center. COVID-19 seems to have only exacerbated these trends. And so, what we've seen in terms of sort of governance and sort of decision making is that you've seen, for example, like the UN SG high-level panel on digital cooperation was co-chaired by Alibaba, private sector, and the Bill and Melinda Gates Foundation, with relatively low, minimal involvement of civil society. And so to address this going forward, we have to, I think as Katie mentioned in the opening remarks, we've really got to be cognizant of the histories of the manifestations of colonialism in aid and globalization. And we've got to call for and prioritize meaningful involvement of civil society and communities in the design, implementation and governance of these tools. The third area that I highlighted was really around the need to address that we as health advocates who have and continue to fight for many other priorities are coming to the digital space late, and that we really have really low levels of knowledge amongst our communities about digital literacy and digital rights. And so it's really, really important that we're sort of building and empowering each other so that we understand what rights they are that we should be fighting for. So those are all the concerns, of which there are loads. And sorry, I went on a little bit long there, but I've just a couple of things that are exciting. I think if we can resolve the concerns, then the excitements follow. Those are that, we have the possibility to have instant access to information, knowing that there's a potential to curate spaces that are unique for each communities, so that we can connect, engage and advance our advocacy efforts. It's also exciting, the mobilization possibilities, particularly of young people. And I think the examples that we've seen recently around like some of the TikTok activism around abortion in southern states of the US and on issues like Palestine. My sister is a head teacher, and she was saying, like, young kids sort of getting up on the desks with their Palestine flags. It was sort of, all based off TikTok sort of knowledge. It's quite amazing. But also the chance to shift epistemic injustice through new forms of inclusion in knowledge production. And that's one of the things that we've been trying to do through DRAG. I need to stop, but I think I just wanted to highlight a couple of things that I think this is really important that means for the Global Fund. And that really is to ensure that a rights-based approach is sort of put centrally at the Global Fund in relation to digital health and technologies. We need policies and technical guidance that will ensure that the risks to human rights are fully assessed and safeguarded, with obviously particular attention to key and vulnerable populations. And we need to empower communities and civil society to lead, design and assess digital initiatives. So, just going forward, the calls to action really are, we need to build our understanding amongst ourselves. We need to then examine the Global Fund strategy and its different policies through those lenses and use our different mechanisms through the board, through other, the community rights and gender, advisory groups, etc. We need to ensure that there's strong civil society and community involvement in the Global Fund's digital framework that I know John's going to be talking about. And we really hope that we'll be heavily involved in a consultation in the finalization of that framework. And then we need to, in all the sort of technical guidance and sort of TRP grant application review processes, that all these human rights concerns and issues are addressed as the Global Fund goes forward into implementing its new strategy. Thanks very much. I'll stop there.
Thanks, Mike. That is a lot, but it's really helpful to get your perspective, and thank you for sharing the perspectives from DRAG, which is an unfortunate acronym, but we do love our acronyms here. So in Global Health, so we will use that one. But just, thank you for that and for, letting us know just how much more knowledge and information there actually is within the GFAN sort of group and colleagues who are working on these issues. So I think it's really helpful. And Njide, we're going to come to you next. And obviously there was a lot there in what Mike said that you might just want to address. But the question to you is just to understand a little bit better from the work that you do, who are the key sort of global actors that are currently influencing the shape of digital transformations in global health? And what, from your perspective, where are the avenues for civil society to take influence on those agendas? I mean, it's a big question, but we'll pass it over to you and hear what you have to say and remind ourselves that this is the first of many conversations and not the last one. So, Njide, over to you.
Thank you, Katie. And thank you, Mike, for really elaborating on quite a number of things. I think that I want to probably step back, and I'm going to be speaking from the lens of a developing country, because normally that is where a lot of the development and the support comes from. So when we're talking about digital transformation, from the lens of the low and middle income countries, it seems a bit remote. There are kind of 4 stages. First, you have the manual processes where it's paper-based totally. You have the digitization where you're transforming that paper into an electronic process, which is device-driven. Then you have digitalization where it's process-driven and user-driven. Then you get to digital transformation. And if you look at where we are, and I'm talking from the perspective of low and middle income countries, we are stuck somewhere between the manual process and digitization, although there are pockets of digitalization going on. We're not yet in a situation where we can say digital transformation is happening. And why is that? Because there are basically some fundamental pillars that are lacking. One, electricity. These are basic infrastructure that needs to be in place. 2, you have connectivity, mobile technology, internet connectivity that is really in pockets of urban areas across Africa. Then 3 is the digital literacy. People understanding when they have those tools, how do they use it? So there are these fundamental pillars that are obviously lacking. And if we have to accelerate digital transformation across the world, especially Africa. And when I talk about Africa, we have to recognize that over 60% of the young people in the world reside in Africa. So as we are looking at ways to expand coverage, expand access, and use digital transformation to ensure that no one is left behind, we have to already step back and look at how to address some of these issues. Interestingly, I am one of the commissioners in the Financial Times and Lancet Commission on using digital technology and artificial intelligence to accelerate UHC by 2030. And we've looked at so many different issues, some of which Mike mentioned. How can we develop policies and guidelines, and how can the multilaterals, the national governments, all align around the same guiding principles? And this is something that really needs to take hold, because as we can see with the advent of COVID, if one part of the world is left behind, everybody's behind, because it goes around and comes right back at us. So these are some of the things that we are looking at. Just to talk a little bit about PharmAccess and the work that we do. We have a global MOU with the Global Fund, which covers quite a few countries. We're in about 4 African countries, Nigeria, Ghana, Tanzania, and Kenya. And Nigeria is quite peculiar in the sense that Global Fund has been, of course, investing a lot of money in disease programs for many years without seeing results. And, Lagos in Nigeria was the first state where Global Fund took a step back and said, how can we work with PharmAccess to strengthen the system such that, the system is sustainable and stands on itself even when Global Fund is not there. So, and again, this is of course using digital tools. So we embarked on quite a number of activities, both on the demand side, creating the demand, on the supply side. And I'll give you a few examples just to give you a sense of what digital can also do to enhance and help Global Fund achieve its objectives. So the first is we helped Global Fund to develop a mobile application for TB screening. Now, we have one of the worst indices in terms of detection in Nigeria, but transforming just a simple algorithm into a tool that can be put in the hands of community workers, we were able to increase case identification by almost 200%. Now, we took it a step further saying, okay, now that we have this tool, but we're identifying people who cannot access healthcare services, how can we then expand using this tool to enable them access? Then we included the poverty mapping tool to this mobile application for TB screening. So you test through another algorithm whether the person qualifies as an indigent, cannot afford to pay. Then funding is made available for the person to receive treatment using that same digital tool. Now, on the supply side, there are also tools that we helped develop, working with the agency. There's an agency in Lagos called HEFAMA. It's the Health Monitoring and Accreditation Agency responsible for accrediting all the healthcare providers. So what is the point of directing a patient to a clinic when you're not sure what the outcome is? So through the Global Fund grants that we were implementing, we developed and strengthened the capacity of this agency to govern by giving them a handheld health assessment tool, so they could actually assess facilities real time. Then you can easily then direct patients to those facilities. So all of a sudden you're seeing a situation where digital, even in the smallest siloed bits, it appears siloed, but you can begin to link them together, and ultimately you are beginning to get data that you can use. But also from the Lancet's point of view, a mantra really is that there's no health system without health data. You cannot determine who needs to be covered, and in Nigeria, you can't even identify the citizens because the systems are not there. But with a mobile phone, you can begin to assign identities, digital identities to human beings. Then you can begin to look at how you can provide services to them. So how do we begin to use these simple tools that are already existing? It doesn't have to be high-tech, but basic simple tools, small applications on feature phones. Nigeria, by the way, is one of, sub-Saharan Africa is one of the highest adopters of digital technology. Nigeria has a population of over 200 million, and we have about 171 million active phone lines. So you can imagine the power of that mobile technology and what you can do if we leverage it and use it to create access. So basically what we are trying to do, both from the PharmAccess point of view and from the Lancet point of view, is to develop a set of guidelines that would guide countries to implement digital transformation. Our report will be launched next month in Berlin, and it's really for all the countries, regardless of where you are in terms of UHC or digital transformation implementation. But there is something to learn in terms of how do you protect the rights of individuals? How do you ensure equity? Like Mike said, digital actually exacerbates equity if it's not properly monitored and administered. So there are some guiding principles around which we feel that not just policymakers, but the users of the data, they need to be aware. And then we begin to align civil society. As Mike mentioned, the private sector is in the lead, especially in Africa. There's so many funds, there are so many programs, there are so many innovators that are doing significant and tremendous work, leapfrogging what is actually happening in the rest of the developed countries. But the question then is, how do we ensure that it's taken to scale? How do we ensure that the regulators, by the way, who seem to be far behind the innovators, are brought up to speed? So there's a lot of capacity that needs to be built alongside the regulators so that they're able to better regulate the innovators. I'll give you a funny example, which is true in Nigeria. About 8 years ago, there was an idea, a company, a fantastic innovator that was trying to work with the National Health Insurance Scheme to develop a mobile insurance program where the premiums are collected through airtime and so on. And then from there, a portion of it is paid to the providers, a capitation fee for service and so on. But you wouldn't believe it, the mobile, the GSM company wanted 60% of the premium as their fee. So in a sense, how do you begin to, this kind of environment will never allow this kind of innovation to work. How do the policymakers manage these kinds of private sector driven profiteering, or how can they partner with the private sector to create an enabling environment so that this kind of innovations can actually thrive? Because ultimately it's to the benefit of all the citizens. And I can tell you that till now, nothing has happened in terms of driving that innovation to scale. So I wouldn't say much further, but just to say that there's a long way to go in developing countries to get to where we can say that digital transformation is possible on a large scale. There are pockets of innovative work happening, but there's a lot of work that needs to happen to bring together the private sector, the legislators, as well as the civil, the donors and other multilaterals to work together to create that environment to make things possible and sustainable for digital transformation. So I'll stop there for now.
Thank you so much. Super fascinating. I was busy typing notes through the whole thing, although I know Conte will share notes from this call and the recording and so on our website. But I think one of the things you said about health systems without health data, which just really makes a lot of sense, and the idea that there's a lot of work still to do within our communities and within our societies to make sure that people really have a solid understanding of digital literacy, which is something that in a long time ago I spent 6 months at an education NGO, and I can tell you that even then, digital literacy was something that was a challenge to communicate and to understand in broadly different ways. And it seems like with the advances that have taken place in the last few years, this is the need for that and the need to be clear. So we look forward to that report that you were mentioning that will be launched next month, and we hope that you'll share updates from that. But sorry, just random reflections from me, and to thank you for those excellent comments. And I'll pass it over to John from the Global Fund. And John, I mean, so much to answer there in terms of what both Mike and Njide have said today. But, what we're just trying to get a sense from you on is there's a new strategy that's being developed. There's a lot of discussions at the Global Fund. There have been for some time. There's been a lot of work around and a lot of thinking that's gone into how the Global Fund uses and, advances the use of digital technologies. So just could you bring us up to speed quickly on where the Secretariat is at with all of that and how you expect to see digital transformation, digital technologies reflected in the new strategy, and what areas of work you think there are for us as civil society and communities with you and with the Global Fund at large and with country partners and so on in advancing sort of some of these concepts that we've talked about today about equity in health outcomes using digital technologies. John, over to you.
Thanks, Katie, and thanks, Mike and Njide. I'm losing my voice, which you may or may not be able to hear, so hopefully I will last. But I mean, I agree pretty much wholeheartedly with everything that you both said. I think the thinking in the Global Fund is developing quite quickly, and I think positively. And a lot of this is the recognition that the landscape. I think to the point you made, Katie, it's both. We're all of us, I think, are incredibly hopeful about the sort of transformational opportunity that this brings, and I think we need it. We recognise that even before COVID, the progress against HIV, TB, malaria was drifting off track, and we can put more money into this, but we also need to spend that money better. We need better data. We need better tools that are more efficient. So, COVID has re-emphasised it as well, but this need to accelerate progress, and this is one of the key levers. But I think we all should be rightly nervous that it isn't just about the what, it's about the how, as you very clearly sort of identified. And I think it's also about recognizing where we start from. And so maybe just to start there, there's been a lot of progress certainly in data systems. If you look at the sort of Global Fund sort of high impact countries, nearly 100%, 97% of them have digitized HIV, TB and malaria information, but the quality of that data isn't great. About 2/3 have quality rated above medium even. And then if you look at the end that, certainly Mike and Njide talked to, the sort of community health information systems, only just over 1/3 have a community health information system that's integrated into the national HMIS. And that's that's definitely developing. There's the investments this period are 70% bigger than the investments last period. But clearly that's a fundamental gap in our ability to have information, and feeds into the inequities and many of the risks that Mike and Njide identified. So there's a lot of movement, there's a lot of investment. Whether the investment is going in the right places and whether it's investing in the right sort of technologies is definitely a question that we need to answer. I think the other thing to say is that we often talk about this as the health management information systems, but as again you both recognise, it's not just that. Many people are now using WhatsApp and Facebook. In many of the countries, that's not a health information system, yet it has probably some of the best health information and some of the best discussion around health and prevention in HIV that you can see in many countries. So there's many other data sources I think that we need to think about. So the way the Global Fund's thinking about it is in two levels. First, I guess, to recognise that the opportunity, which I won't go into because I think it's clear, but also to look across the challenges. And I won't go over all of them because there are many, but the truth is that if you look across the countries where the Global Fund works, the maturity of systems is very varied. The maturity of governance and many of the issues that we're talking about is incredibly varied. We don't have enough money for these sort of global good development, which means that many of the systems are bespoke and weak. And most importantly, often they don't talk to each other, so they're not interoperable, which means your ability to compare finance data and disease surveillance data is challenging. I think, and Njide mentioned this, there's too much focus on new stuff. Everyone gets excited about the new app and artificial intelligence and all of these sort of things, but the truth is much of what we need is relatively simple and straightforward information systems. AI could be fantastic, of course, and done well, I think it could be really powerful, but it's not the crux of the sort of transformation that we need at the moment. And of course, AI can't work effectively if you don't have a basic system. If your data is not representative of populations, including key populations or different ethnicities, then it won't work effectively either, and just exacerbate the challenges. So we need the basic information that's important. And I think most importantly, this capacity in countries to manage digital, even to develop digital. One of the biggest challenges with a lot of the global good deployment is that countries don't have the capacity to manage and develop it. So open source software is fantastic, but if you don't have the capacity to develop open source into your solution, then it becomes this potentially sort of colonial approach to IT that we want to avoid. And so building this capacity on the ground in terms of local private sector, in terms of public sector management, in terms of governance is going to be really central. You know, and at this point about the landscape is shifting, you know, anyway. You know, we have a conversation in the Global Fund talking about HIV prevention moving online. It's moving on to social media in many countries. And so how do we engage in that, and how do we make sure that those platforms, you know, have the proper respect for privacy and security? And then most importantly, I think that people have trust in these systems, which is obviously linked. But if we want people to provide data, then not only does it have to be, you know, private and secure, it has to be trusted that it's private and secure, and that is really important. We build it, and I do think that is a key role for civil society, obviously, to both ensure the privacy and security is appropriate, but also to ensure that the message around trust and the support is there too. So I think, you know, the way the Global Fund's approaching this, I guess, is at two levels. We're developing the strategy framework, which I'm sure many of you have seen, and that's in draft in the board for the board's discussion at the moment. So whatever I say here may well be out of date by tomorrow once the board have edited it. But it's really looking at the data is cross-cutting. If you look at that strategy, I did a word search just before I came on the call. Data is mentioned 123 times in that strategy. I suspect it may be one of the most mentioned words in the whole document, but I haven't compared it to anything else. It cuts across the diseases. Obviously, it sits strongly in the health systems piece. And the objective that is framed in there is around strengthening the generation and use of quality, timely, transparent, disaggregated and secure data at all levels, aligned with human rights principles. So I think the objectives in there is framing, you know, the positive and the need, but also that we need to, you know, the how is really important. There's a number of objectives underneath it, which I won't go through all of them. I just picked out the ones that may be relevant for this conversation. It's clearly about strengthening the availability, the timeliness, and the quality of data overall. One piece that I think is really important, and again, where, you know, this community will play a really, you know, key role, is reinforcing the monitoring of health inequities, actually making sure we have data that tells us where things are not working. You know, where our programs are not reaching the people they need to reach, or where human rights abuses are being perpetrated. So that's a clear objective in there. There's another one around scaling up community-led monitoring, which I think speaks very much to Mike's point about we need to build this. And I think the critical space of this is making sure that we're investing in the sort of last mile of information collection, of information systems. And I think to the point that Mike made, that those systems are being designed with communities, with people, to make sure they're effectively designed, they're functional for people, and they're collecting the right information with the right protections as well. And then there's another one around strengthening data governance, leadership and management, which is very much around saying, as you know, a core principle of the Global Fund is country-led, but making sure that the policies that support this, policies that support protection and privacy and appropriate sharing of information are really strengthened, because that's going to be key. So that's the strategy framework the Global Fund's developing. Now, underneath this, and Mike, you know, we talked to you a little bit about this, the Global Fund's developing a digital framework, which is really the sort of secretariat document that will allow us to sort of guide and implement underneath that sort of strategic framing in the Global Fund strategy. And in here, we have a series of sort of questions that are guiding us, and then a sort of 4 key pillars that I think speak to a lot of the questions and comments that we've heard already. I won't go over all the questions because there's a lot of them, but we're asking about, are we measuring impact and performance at the core? So are we sure why we're investing in which systems? Are we fostering building blocks, not proliferating systems? So we're not adding to the complexity and this focus on new rather than existing. We're making sure we're country-led, and obviously very clear, the way we're investing, is it driving the security, the privacy, the equity, and the trust in the systems? And then also, are we making sure that we're investing to empower health workers? One of the key challenges around information is it often ends up coming in one direction. So it comes out from the last mile to the center, but it never goes back effectively. And so it's not empowering people or health workers to manage their health or do their jobs effectively. So that's in there. So what this means is there are 4 sort of pillars in this digital framework that we're developing. And this is still very much under construction, as Mike and others know. But one of them is that we need to enhance the Global Fund's capabilities in this space. We like everyone else, are learning a lot. We're keeping up with the developments. We're not experts in digital health. And interestingly, we don't have a technical agency that is an expert in digital health either in this space. So we need to develop our capabilities to do this well. We need to make sure we're reinforcing the country digital systems, the ecosystems. It has to be country-led in what we're doing. We need to advance this interoperability. We need to build systems that talk to each other, that have good data integrity, and we know where the data's come from, so that we can verify its quality. And we need to amplify and lift sort of access, and we need to emphasize equity and human rights in what we're doing. So those are the pillars that are guiding us in the new digital framework. So I think having this framework will allow us to be much more deliberate about the strategy going forward and about implementing under the Global Fund strategy. So I won't talk for much longer, but just to give you a couple of examples, I guess, of what this sort of means or starts to look like in practice. One of the partnerships that we've actually just signed an MOU with is with the ITU. And there, the idea is to start to map their understanding of connectivity across the health access system, and therefore start to build sort of better maps of where is access good and where is access weak. And what they're also very capable of doing, because they do this across sectors, is build a clearer investment case for that connectivity change. So that actually we can start to build a partnership which identifies where we need greater connectivity and greater access to support the agenda, but also we can start to make a clearer investment case, which is actually probably isn't just about health, because obviously connectivity supports commerce, it supports agriculture, it supports many other things, education as well. So that just one example of building this out. And then the other one is a partnership that we have with Rockefeller, which some of you may know. And this was a catalytic investment that we launched in the current replenishment cycle. And it was very much focused on sort of data science in the last mile. So it's about this problem of building information systems from the sort of last mile out and making sure that we're building the sort of collection tools that allow us to integrate community information more effectively into the health system as well. And I think, they're just 2 examples, I think, of how the framework is starting to guide us to the right kind of discussions and partnerships as we go forward. And then the last thing I'll say is that, what Mike has said is, as we develop this digital framework, he'd really like to carry on the conversation that we started with Mike and a few others, and make sure that we're building it in partnership with this kind of conversation. Because I think the truth is that, the problem statements that Mike laid out are very clear. The solutions to them obviously are also complicated. And the ability of the Global Fund to influence some is greater than the others as well. So really important that we carry on this conversation. So I'll stop there and really appreciate the chance to speak to people.
Thanks, John. I think it's really helpful to get that overview. I know that there's some folks on here who have been following this more closely than others. You'll see a question from Robin in the chat that you might be able to get to. Others have been sharing some thoughts throughout the conversation that you might want to have a look at in the chat. But I just invite anyone who would like to speak or ask a question at this stage to please use the raise hand function or just pop it into the chat there if you'd like to ask a question at this stage, or just unmute yourself, because then I think I can see you unmuted and can call on you if you're having trouble with the raise hand function, which seems to disappear sometimes, but is usually found under either the participants or the chat function. But as a chair, I can't tell you where that is. Kirsten, I see your hand raised. Kirsten, go ahead.
Thank you. Thank you, all speakers. Really, really important discussion, and I'm hoping this could become something that will return either in this forum or elsewhere. I guess my main question would be to John Fairhurst about. I mean, it's great to hear that a framework is being developed. I was wondering a little bit about monitoring and evaluation. As several people have mentioned, there's a lot of initiatives and very little regulation, and also a lot of sort of for-profit incentives to develop models. And I think what we are seeing as MSF, when we are working in this space, there's very little evidence being generated, especially in poorer countries and in conflict affected countries, etc. But across the board, I think there is a question mark around independent evaluation and monitoring. So I was just wondering, how is the Global Fund planning to build that into a framework and a strategy in terms of evaluating, and especially with emphasis on the independent evaluation? Thanks.
And if I can, I'm just going to go to Robin and Cedric, who have their hands raised, and then I'll turn it back to John and others who are pointed to in their questions and comments for feedback. I hope that's okay with all the panelists. So Robin, go ahead, please.
Sure, thanks so much, and totally agree with Kirsten. This is a really helpful and exciting kind of conversation. So looking forward to much more to come. I've had the privilege of being part of some of these discussion forums that we're talking about here in the chat. And one of the questions that I did raise in one of those forums, and would love to hear from John, hate to put you on the spot, but also to hear from others in the room with us, is how do we link climate action and renewable energy with digital health transformation, recognizing just the ecological and environmental imprint that this sector has? And so when I'm thinking about the Global Fund in particular, and John, the work that you're doing together with Michael Johnson, I imagine, and the stuff internally that's the conversations, when we're talking about the next Global Fund strategy, we're talking about how we can engage with the climate sector, right? And this would be a really great opportunity for the Global Fund to really step out in front and to demonstrate that. So on something so important, and that, the digital revolution is already happening, or has happened. So we're catching up in a lot of ways. But the linkage between climate and ecological and environmental footprint hasn't really ever been discussed within this landscape. And then how that relates to risk and vulnerability of the populations that we most care about and that we serve, particularly when we're looking at, global warming and the shifting climate implications that have direct impact on migration trends and droughts and all sorts of things like that. So just a little tiny question there. Sorry. Thanks.
Just the smallest of questions, Robin. Thank you for keeping us thinking in a multidisciplinary way, though, today. It's really actually quite helpful. I'm sure there's other reflections on those kinds of things that we should be thinking about. Cedric, over to you for your comment or question, and then I'll pass it back to first John and Mike and Njide for their responses or thoughts and reflections. Cedric, go ahead, please.
Yeah, thank you, Kitty, and thank you for the panelists. I think it's a very interesting session. I'm really grateful to be here today. I have kind of question, or maybe a thought that it didn't trying to figure out, and I would like to have input from Mike and Njide, and also maybe John to. So in terms of, we've mentioned like the digital transformation is mainly being led by private sector, and we know that they have power, they have money, they have everything they need. The community, we are still lagging. They're trying to find out, we're still talking about, digital literacy. What would it take, for the community to be at that stage, to be engaged fully in that, in digital transformation? And also, I think if you also think about countries, wouldn't be too late. We are talking about this now, and countries are still suffering to at least get electricity, as you're saying, to, for like a national coverage. And then other people are like, the train is, moving very fast in terms of digital transformation. And then here we are discussing about, literacy. What would it take for us to get there? And it wouldn't be too late. I'm just wondering myself, and I think I thought like, maybe let me put the question on the table and then see, would there be anything to save in the next 2 or 5 years?
Thanks, Cedric. I think that's a really, good question, and I see some other hands starting to raise, and so we'll come back to you after we hear from the panelists on those questions. John, I'm going to flip it to you first because there were a few specific questions to you. As long as we haven't lost John, no, there, okay, and then over to Njide and Mike for their reflections as well on that set of questions and comments. John.
Yeah, Robin's question is tiny, but I mean, just on the first one, on the M&E, Kirsten, that's definitely one of the outputs of this digital framework. So, I mean, as I'm sure you know, MECA, which is the Global Fund's monitoring and evaluation unit, has in essence for the last few years been the centre point of the digital work in the Global Fund. But what we haven't done is a framework that goes sort of broader than just the sort of HMIS systems. And I think, as the conversation today shows, we need to look more comprehensively than that. So linked to the developing framework is a series of sort of indicators and KPIs, which obviously will build up to the ones for the strategy, for the strategic objective on data. But underneath that, we'll have a series of others that pick up. But at the moment, I think particularly the 4 sort of columns that talk about sort of capacity, country-led systems, interoperability, and then sort of access, equity, and human rights. So I think that will develop a much more sophisticated framework that's broader than just not that these are not important, but things like data timeliness and data quality, and those have been the key indicators around information systems. So this framework will broaden those out, which I think is a really good thing. On the climate side, I mean, I think I could answer that in probably 4 or 5 different ways. I mean, and this is my personal perspective, so don't take this as Global Fund policy. I mean, I think one part is that we need to, it's a bit like the partnership with the ITU. We need to be much better at overlaying the data sets between the different sectors. So, to your point, Robin, I think overlaying the sort of risk areas, that are affected by climate change, which I think are increasingly, well known, and actually increasingly we're seeing it already. Overlaying that with the health surveillance issues, and making sure we're using that to create the sort of risk maps around this. I think is going to be important to make sure that we're not just investing for today, but also tomorrow. That we're understanding the sort of longer term perspectives around climate. So I think that's one piece of it. I think that we, by creating better data, but by doing things like we're doing with ITU at a much more simple level of overlaying, the information sets, I think we can come to a much more, intelligent, smart way of thinking about the intersection between the diseases and climate. That's one way. I do think, and actually, funnily enough, yesterday I was helping my daughter write an essay on silicon. She's 13. And so we were doing a lot of research around silicon, but one of the key things obviously is the technology sector is having a huge environmental footprint, and I think that's something that the Global Fund in general, I think it's a piece of work we're doing at the moment with sourcing, looking at the sort of environmental footprint and particularly things like waste management. Is really important. And so we have a series of partnerships we're working on at the moment to try and get a bit more sophisticated about that. And I think COVID obviously has brought that even more with all of the sort of PPE that is circulating in countries, made that more urgent. But I do think as we think about some of these strategies, we need to apply a sort of climate risk factor to them, if you like, which is not to say we shouldn't do digital interventions, but we should be conscious. I mean, there is clearly things like blockchain, which can be heavily, climate negative if it's done the wrong way. So there has to be a risk factor, I think, that we look across the areas. There's another set of areas too, but maybe I'll stop there. But I'm sure Mike and Njide could be more intelligent on that question too. And then maybe subject to your question, just quickly. We talked to this a little bit with Christoph the other day, but I do think we almost have to have a sort of two timeline approach to digital. And one of them is to say that there is a short-term timeline that we have to deal with because things are moving really quickly. And we have to be able to work in the context of it. And of course, we want things to move quickly, appropriately. But we really want to accelerate this transformation. And if we think about the SDG targets, we don't have 15 years to accelerate this. But I think in many countries, things are moving very quickly and to some extent, maybe too quickly, where the digital systems are moving ahead of the people capabilities. So I think that sort of short-term perspective is really important. But equally, I think, and this is always, as you all know, the challenge in the Global Fund 3-year funding cycle. I think we have to have a perspective which is longer than 3 years. We have to be thinking forward to the end state, which may take 5, 6, 7 or 8 years to get to. And I think that is how we have to hold the pen to make sure that we're accelerating what we can in the short term, but we're making sure that we're building sort of sustainability into the long term of what we're accelerating. Because the last thing we want is to put in place systems that fail after 2 years or 3 years of global fund financing. So I think we have to hold both of those perspectives at the same time, particularly in this space, because the ability to move quickly is here in digital, which is not always the same in other spaces, if that makes sense to people. But anyway, I'll stop there because I'd love to hear from Njide and Mike.
Please go ahead, Njide. Yeah.
Okay. Yeah. Let me start with Cedric's question because that is so fundamental. I think that the way we look at it is to give that responsibility to the national government. For as long as we can remember, Africa remains kind of a donor continent where, the governments just rely on external parties to fund, responsibilities that should be theirs. So in terms of infrastructure, literacy, the basic building blocks required within the countries, what we are trying to do is, at least with our report, is to highlight some of the enablers, some key low-hanging fruits that need to be put in place before you can talk about digital transformation. And then from there, at least make the leaders and the legislators within the countries aware that these are, they're connected dots. If you don't educate a child, then how do you expect them to be digitally literate? How do you expect them to contribute to the development of your country, then much less the healthcare system? So we are, trying to identify those building blocks, but at the same time also encourage multilaterals and developmental partners, to think about where they want to invest their money. As we've done with Global Fund in at least in Lagos, where we are saying, we've shown data that actually proves that, it's cheaper to provide health insurance, for example, as opposed to focusing on disease-specific interventions, because you take care of the whole person. So can we step back and look at how can we put in the building blocks, the infrastructure, as opposed to paying every year for a child to be treated for TB? Is there a way we can put in systems in place that, will be that will create for sustainability? I think this is, there needs to be a change in mindset in terms of support, developmental support. Let it be country driven, what the country needs, as opposed to checking some boxes to make sure that the fund that you're giving to countries are, spent in a specific way. So can we flip that around and apply funding or donor support to country needed areas? And it doesn't really have to be directly in the healthcare system, but it can be put in place where it supports tangentially to the healthcare system, because we've come to realize that there's so many different fundamental areas that are interconnected. When you talk about the climate, we've seen, how it connects, in terms of are people able to farm, and are they able to be productive, and how does that end up affecting their health? So there are a lot of connected areas, not specifically directly at health, but the impact on the healthcare system. So can we begin to look at the system as a whole? Look at education. How do we make sure that there's digital included in the curriculum of children? How do we ensure that there's electricity? So they're just basic building blocks. So as a developmental partners, how do we change our mindset to look at the whole system as opposed to specific interventions for which we can check a box and send in a report that we've accomplished our goals for that year? So I think these are some of the things that we need to begin to think differently outside the box. And hopefully, there's a change, and the local leaders understand their roles and responsibility, because ultimately they have to take the lead in driving the change that happens within the countries. So I'll leave it at that, but it's clearly a very difficult topic. And as John also said, you have to take it in small bites. There's so many different fantastic innovations that are going on within Africa, leapfrogging what is happening in the rest of the world. And if you look at even fundraising for innovation, fintech, Nigeria all of a sudden is becoming the place to go to, because there's so many fantastic innovations. And these are just based on simple technologies, but are reaching the people. It's okay for the innovators to make a little bit of money here and there, but can we create that enabling environment that allows for people to think outside the box to drive these innovations? And down the line, we can connect, maybe aggregate some of those that work and find a way to scale it. That's the way we're looking at it. Otherwise, it's too daunting a task for any one person or organization to take on.
Thanks, Njide. A lot of really great comments there, starting off by answering Cedric's question, but also getting to Robin's sort of question around climate and that need to look at, other sectors. Mike, did you want to jump in with any sort of general comments or answers here? And then we'll come back to the rest of the group for further questions. And again, I just remind the speakers and the panelists, whatever we're calling you today, sorry, that there are some questions and some comments going on in the chat that you may be interested in looking at. And hopefully we get one more round of questions, answers, and then I think it will be time to wrap up. So Mike, over to you for any thoughts.
Yeah, thanks, Katie. Yeah, I think a lot's been said, and I just sort of echo, yeah, but really the need, I think raised by Robin and commented on by John and Njide around, you know, the impact of the climate on of digital technology, and so really a huge amount that we need to learn. Just reading about the climate impact of Bitcoin, for example, it's just like really shocking. But yeah, the main comments I just wanted to make, and I think it's largely all been said, but comment is set to Cedric's question. I think, you know, the first question is like, what about those? Are we all? What about those who are missing the train? Are we all missing the train? And are we too late for getting on it? And I think I'm increasingly coming to the perspective that just like the SDGs sort of came to the realization that actually the leave no one behind sort of philosophy and approach needed to be applied to the whole of international development. I think this is exactly sort of what we need to do with digital technology. There's just so much out there that's exciting and shiny and new, and you just want to grab it and focus on those things. But actually, what we, I think, as sort of society and communities really should be saying, no, don't look at the exciting thing. Look over here. They're the people who don't have any access, don't have any, you know, electricity, the infrastructure, etc. And I think that's really important that we give at least equal, if not more, attention to that than we are to like the exciting innovations that are sort of popping up all the time. You know, I think all of us sort of have this sort of slight FOMO feeling but we need to sort of just make sure that we are very clear about the principles that we're applying to engage with any of these new interventions. There was some help, I think, helpful the UNDP's principles there in the chat, and there are many others. And I think we need to be utilizing those, make ourselves all aware of those. We need to make sure that there are accountability mechanisms for each and every one of these sort of digital technologies. And that's, you know, we talked about the design involvement in design implementation, but crucially the governance. And I put in the chat around, you know, I think John was making a point around actually, you know, most people are actually engaging through these general technology platforms, even for their health information. They're not, you know, actually largely using sort of like health specific apps. There are some useful ones out there and we can utilize those, but actually most people are using Facebook or, you know, Instagram, TikTok, etc. And how do we as a health sector engage in that and, you know, ensure that there's quality information out there, that there is effective regulation? And I think what that will mean is that we are going to have to break outside of our health sector. A few comments have been made around the importance of sort of cross-sectoral collaboration, both in terms of, you know, obviously there's the infrastructure there, etc. But in terms of sort of how we engage with these general platforms, we need to be advocating to the government, joining with digital rights activists across the board who are calling for government regulation, who are calling for the governments to break up monopolies of these big tech giants, so that we can actually insist and build on the small steps that are being made to sort of have some sort of governance of these tech giants. And we need to make sure there's a health voice in those governance mechanisms, alongside education and other, you know. So I think, I mean, there's only a few things to do there, but I think those are absolutely the right questions that you're asking, Cedric, about, you know, what we need to focus on. Thanks.
Thank you all. A lot of comprehensive comments. I've just posted where we'll be sharing the recording so people can re-listen and think about some of these big questions. But I see another hand raised, and I just wanted, I see Alan and Sally, if you're still on the call, you'd had your hand raised. If it's been answered, that's fine, but I'll jump to you next after Alan if you still had a question or comment. I see a comment there in the chat. So, but Alan, over to you, and we'll see if there's any other questions or comments, and then maybe some final quick wrap-ups from the panelists, and then I think we'll probably be fairly close to our hour. So Alan, and then Sally, and anybody else if we find a third. And then, yeah, Alan, go ahead. It's so lovely to see you.
Lovely to see you, and so lovely to see many familiar faces. Mine is a more or less top-level question, but slightly lower to John and the rest of the colleagues who are the Global Fund, in terms of the fact that we know we had a successful replenishment and grants have already gone out, but are there any investments that are going towards building the capacity of civil society and communities to understand some of these challenges that digital technologies bring? I know everyone right now is hell-bent on developing their principles and standards and guidance at that global level, but the real rubber is meeting the road at the country level, and what kind of investments can we direct there? So I'm looking more like, how more are we tweezing money out of the country grants that are aimed at dealing with human rights, gender issues, community involvement, community-led monitoring that could have aspects of digital rights, seeing the effects of use of technologies and artificial intelligence to affect the 3 diseases, or other broadly the health sector. So I think we also need to think about that conversation, because even as we negotiate language around principles and things, the action is already happening, and we need to get our communities and civil society on the front foot. But thanks for having the conversation. Just maybe some reflections on that. Over.
Thanks, Alan. Sally, I'll pass it over to you.
Hi, everyone. Yeah, I was just recalling that many years ago, working in a national organization that's mandate was about teaching women to use information and communication technologies and take up space and on digital rights. And it seems like now in the sort of health sector where I'm located now at Frontline AIDS, there isn't a sort of, these two spaces aren't talking to one another. There have been years of digital rights activism, but in the sort of health spaces, there doesn't seem to be an awareness or a joining of forces. What I guess I'm most concerned about is that civil society organizations in the health context and marginalized populations, CSOs are not playing the role of watchdogs when it comes to digital health initiatives, and they don't have the capacities, and their attentions are sort of thinly spread and divided. And so it seems that there needs to be some concerted efforts to help civil society organizations at national levels play that role more strongly. We already have guidance for how to meaningfully involve and to provide support for the leadership of marginalized populations in health systems. So I'm not sure why we think that when you digitize something, somehow those prejudices and inequalities disappear in the zeros and ones of digital health. They still very strongly manifest themselves in all spaces. Digital health is not somehow exempt from that. And so we need to work harder, I guess, to get those organizations much more actively involved. I know Alan has been doing that work and lots of others have been doing that work, but it seems to me that we would do well to link up with the activism in the digital rights spaces and in those sort of more traditional internet rights spaces. Thanks very much for the discussion and for everybody who's contributed.
Thanks, Sally. Thanks, Alan. And I think those are helpful reminders, but also for people like myself who are a little bit new to some of these spaces in terms of digital transformations. It's just really helpful to hear, some of the other organizations, some of the other spaces where these things have been discussed and who's doing some of this work. I see another link from Leslie there in the chat that we'll make sure that we include. So I'm not seeing anybody else who wants to raise a question at this point. So I just wanted to pass it back to our panelists in reverse order. from the last speaking moment, Mike, and then Njide and John. Just to wrap us up with really quick 1 or 2 minute sort of comments, and also just, again, as GFAN, sort of our objective in all of this is to make sure that within the Global Fund space, we're having these conversations, but also that we're sharing information and providing a platform for our advocates, our activists, our CSO and community colleagues through our 750 members to have access to these kinds of conversations and this type of information. So very interested to know, Mike and Njide and John, if you have any specific suggestions or ideas there for us as GFAN, because I've found this conversation really helpful, and I'm sure there's a lot that we can do to help with a lot of these conversations and share out the information, and especially as we approach a replenishment year. So Mike, over to you for some wrapping 1 or 2 minute comments.
Yeah, I feel like everything's been said really, but I just, I think, really the key is that we just, this conversation is really helpful. We just need to have more of them, both and particularly in the context of the Global Fund. I know, we've been we'll be building those conversations across the delegations with the Secretariat. As the framework is sort of finalized that John was talking about, then and also as the Global Fund strategy, it's good to see so much reference to digital and for some of the addressing some of the risks that we've talked about today. And I think, sort of like really paying attention as the rubber hits the road for the new strategy. About exactly what that looks like, and ensuring, as Alan was asking about, like what support can the Global Fund ensure is in place for civil society and communities, so that the Global Fund, and I think this is sort of, has always played this leadership role within global health in terms of human rights. And I think, that needs to be translated absolutely and straight away across into the digital space. And may actually then provide a little bit of opportunity for catching up, because I feel like as a health sector, we are behind a little bit. So as we reach out across with other sectors, there are some things that actually we have done very well in terms of meaningful inclusion. And so it's partly bringing those strengths also to the broader digital rights conversations. But thanks for hosting us, Katie and GFAN.
Thanks, Mike and Njide.
Yes, something that I want to highlight that we never really talk so much about is the role of advocacy. The fact that we need to really advocate for digital adoption, digital transformation, not just to the government, the national governments, but also to the civil society and individuals that actually generate and own that data. So how do we build that into the work that we do, showcasing the value of the data? Because oftentimes the people that are generating the data don't even know how the data could be helpful. Those collecting it may not see the bigger picture and connect the dots, so they have no interest to collect the data properly. But how can we advocate and begin to showcase the value of the data, which is really the bedrock of the healthcare system, and really making sure that the work that is done with digital transformation is country-led, focused on country priorities and demands, and ultimately should be owned within the countries, and we can support from the outside.
Thank you. And John, for some final comments from you.
Yeah, thanks. And I mean, not that I like to agree with Mike, but I'm about to. So, I do think this conversation is a good one to keep having. I think it's really important. I think the Global Fund is the right place to do, in essence, what Mike's talking about, which is we need to somehow connect private sector, public, civil society better in this space. It's no one else is really doing that. And I think if you look at the chat, I mean, it's sort of the reflection on many of these frameworks is that they're not. whether you're pro-private sector, anti-private sector, pro-citizen, whatever, they're not bringing the pieces together, and we won't be successful if we don't. Because I don't think the solution is all in the public sector, as I don't think it's all in the private sector. So, that combination I think is really important. So it's something we're working towards, which is building a platform where we can bring the conversations together to align a bit more consistently. But I think that's really important. There are quite a lot of parallels with the pharmaceutical space here, I think. And it's sometimes we don't look at it in that way in terms of what tools are being developed. Is there equitable access to the technology? How is it rolled out in places other than high income countries? Who's defining the design of it? All of the same sorts of things that you see in the pharma space. And so I think the experience that certainly this community brings to engaging with that sector is actually incredibly valuable to bring into engaging with the technology sector. So that's one thing I would certainly think about. Then I'll ask two things. One is, this train is moving really quickly, but it's definitely still under construction. So I think this is a good time to engage in this conversation. Different countries are at different stages, but I definitely think there's an ability to influence where this goes if we keep the conversation going and do it. But I think it's really important we get it right, because if we don't get it right, the impact will stall too. It's not, we won't get out of this agenda what we want to get out of this agenda. And so I think it's critical, that we have this conversation more. And then the last one I would say is, I think prioritizing for all of us in this space, we have to prioritize what we work on, because there is a danger of working on 100 different things and issues. And I don't think we'll have collective influence if we try and do too many things. So I think, coming to that conclusion too, as to where do we put what do we put our shoulders behind, because they form the basis of the way forward. Which is not to say, things like AI and everything else are not important and we shouldn't work on them, but I think just having a smaller number of things that we really emphasize is going to be really important to drive impact as well. So I'm really happy to talk about that. Next time I can bring some people who know something about IT as well, but to the conversation. But I think it's great to have it, and definitely, Mike Johnson, who's leading the digital framework, is keen to keep the consultation going. So we'll figure out, what he was trying not to do is break the strategy process by having sort of side consultations and all sorts of things that sort of link to it. But I think as that strategy comes a bit more into focus, it's easier to then pick up this strand in a bit more detail. So I'll feed this back to him as well. But thanks very much for inviting me.
Thanks, and it was really great to have all three of you, and we are completely at time and still on time. But I just wanted to thank everybody for your participation and sharing of resources and comments and questions. I think during the last replenishment, one of the things that the Global Fund was really keen to tell a story on, and I'm not sure how well developed it was, but how the Global Fund contributed to all of the SDGs and had this sort of multi-sectoral, unique kind of partnership approach. And I feel a little bit from what's been said today that, focusing on digital health, digital transformations, and some of that work in this lead up to the replenishment could actually really help to reinforce that message and help us understand and drive sort of the kinds of policies that we want to see at the country level and in our advocacy with leaders and so on. So we have lots of opportunities, I think, over the next year as GFAN to help support all of you in the work that you're doing and maybe bring some some coherence within the Global Fund space around our contributions and our conversations around digital health and the transformative potential there. So I just wanted to say thank you to everyone. I wanted to say thank you to Quentin, my new colleague in GFAN, who's been working with the panelists and others to pull this conversation together. Thank you so much, Quentin, for all of your work on this. And just thanks everybody. I did share a link of where you'll be able to access this and other resources from the call. And we will get that out there, and we just look forward to working with you. Saw some of the suggestions that were in there, Meg, about RightsCon and so on, really open to having these conversations on a more regular basis with all of you to make sure that we can move this conversation forward. So you're late for your next call, everybody. So off you go. Thank you so much for joining. And just really, John, Mike, and Njide, thank you so much for your thoughts, your energy, and all that you brought to the conversation today. It's much appreciated. Thank you, everyone. Have a great rest of your days.
Thank you. Bye.
Bye, everyone. Thank you for joining.
Bye.